Senocalm tablets contain peppermint oil, a natural extract that helps to relieve bloating and stomach pain. It also contains simethicone, an anti-foaming agent used to treat bloating caused by excessive wind. Indications: Senocalm tablets are used to ease the discomfort and bloating that is caused by irritable bowel syndrome. IBS is a relatively common condition that causes stomach spasms and bloating. You will likely feel the effects of irritable bowel syndrome most prominently after eating. You may be suffering from IBS if you have any of the following symptoms: bloating, stomach pain or stomach cramps, constipation, diarrhea, flatulence. How to use: take Senocalm with a glass of water after a meal or before you go to bed. Senocalm can be taken 3 times a day. However, if you forget to take a dose, do not take a double dose. The capsules can also be used to prevent bloating. See a doctor if you think you have IBS symptoms, so they can try to determine the cause. Adults and children aged 14 years and older. Capsules per dose 2 to 3 capsules. Maximum capsules per day 9 capsules. Children aged 6 to 14 years, capsules per dose 1 capsule. Maximum capsules per day 3 capsules. Do not take this treatment if you are allergic to any of the active ingredients, including simethicone. During pregnancy or breastfeeding, we recommend that you speak to a doctor or another healthcare professional before using this medicine. Senocalm side effects. There are no known side effects associated with Senocalm. If you experience any adverse side effects that persist, tell your doctor. Tell your doctor or pharmacist if you are already taking any other medication. This includes medicines you can buy without a prescription.